Do I need to? Hello?
There you go.
Hello, hello?
So here's the volume.
Okay.
Now, if you want to play with that as we go along. Okay. And then when you're done,
Maybe I need to stay further away from it. 145.
okay, just let me know and I can come help you with it.
Okay. This is chapter 39. No, the address for that is on the sophomore bulletin board. It's at a building near Lynchburg General Hospital, and there's an address with a little MapQuest picture there.
But the academics you do here?
Yes. I believe it's February 15th. So all paper things you bring in will come to lab to your clinical instructor. So I've never used a microphone in class before, but I'm trying it just to see because I'm not naturally loud and I feel strained just even in this room trying to be loud enough to be heard in the back. So have you been hearing me okay in the back? Any trouble hearing? Is this, I'm afraid I move around too much for this, but I think it'll work okay. But is this giving me a little bit better volume? Okay, I'm looking at you, Joe, because you're making eye contact, so I'm asking you. You think it sounds the same? Oh, yikes. Okay. Yeah, that sounds different. So I can't see the volume. I don't know. It may not work. I was just trying it out because after doing this for hours and hours a week, I feel really strained.
There's like a way to put the speaker in the back. I don't know if that would make a difference.
I have to be able to connect it to this. So I don't know that it will help.
Does it have to like be plugged into the computer?
It has to be plugged into something up here, I think. Okay, not.
Problem is you're like
Yeah, I know. Yeah, I know that. But I think maybe that's more trouble than it's worth.
Yeah.
I don't really like anything that's extra technology, to tell you the truth, but I thought, I don't know. When I finish lecturing a lot, like I teach this class twice in one day, I have a terrible headache in my brain. I don't like anything electronic or technology. All right, so hygiene. We have to do a lot of things that are highly personal for our patients. So hygiene is very important in regard to infection control and comfort and maintaining skin integrity. And we'll talk about hygiene not only in relation to skin, but also eyes, nose, mouth, ears, peri area, and a lot of different care for our patients. And it's so important to take into account privacy and just things that would influence them. As far as their body image, culture, I mentioned family habits and things like that when we think toward hygiene. So a lot of things to take into account when we have to assist someone with their own personal hygiene. I don't know if I mentioned this story to you guys, but I felt so bad one time to have a patient who'd come from a long-term care facility, and I was helping her use a bedpan. And she was like, I'm so embarrassed to ask this, but could you help me just get really clean down there? Because I asked them at, wherever the place was where I live, and they just won't help me get clean really well, and I feel like I smell that all the time, and I'm so embarrassed. So how awful would that be to feel like that, to feel like I'm not physically capable right now of doing this myself, and nobody's willing to help me do this well? That would feel awful. So we have that level of trust that people will tell us those things, and trust that we will help them. It's very humbling to think about that. So we know about underlying pathophysiology of things like the skin and the layers of the skin, the structure and function of the idea that it's protective to protect us from infection. It has secretion and excretion functions, as well as temperature. When we think about getting someone with their uncovered skin wet and the evaporation that cools the skin, we think about things like keeping them covered and warm as much as possible, and only exposing areas that we're currently cleaning when we give someone a bath. So a lot of different things to think about there. Does anybody play Minecraft? You know what I'm talking about? My daughters play it so much. Every time I look at one of these little cross sections, and it's like dermis, epidermis, and all this, it looks like these little blocks they have on Minecraft. That's all I can think of when I see that. All right, so let's think first of feet and hands and nails, and think toward hands and feet clinic, but also hygiene care for your patients. What are some things you remember looking for when you looked at hands and feet and nails when you did health assessment? What did you assess for? I'm sorry? I missed it.
Circulation.
All right, good. Circulation. So you looked at capillary refill.
Clubbing.
You looked for clubbing. Good. Turgor, and what was? Adherence of the nail to the nail bed. Good. Just overall color, temperature, cleanliness, and condition. So what are some things that you would expect you might see in nails that would indicate a problem?
Deformity.
Deformity, okay. And cracking?
The color. The bow line.
Okay, so those lines and color of nails. So all things we look at for nails. And think about with hands and feet, anything that is painful, any wounds or problems you might have could interfere with activities of daily living. Think, for example, at our foot clinic, if someone whose feet are their means of transportation everywhere, and they have foot pain, they have toenails that are way overgrown and ingrown and infected, for example, it makes their life changed a lot. So that's something to look at when we look at hands and feet clinic, but just in hygiene care with your patients in general, their level of self-care based on what's going on with their skin and their hands and their feet. All right, an example of a problem we might see at the foot clinic with feet would also be athlete's foot. So do you remember learning about tinea capitis in the head, tinea corporis on the body, and tinea pedis on the feet? These are what? Ringworm, which is what? Fungal infection. Fungal infection. So there are over-the-counter antifungals people can use. In the context of the foot clinic, anything that comes up that is questionable for us, we are not in that context able to diagnose and treat problems. So we will have a process to refer to the Free Clinic of Central Virginia, and they do have podiatry and other specialty referral connections to get people, even if they don't have health insurance or are underinsured, to a specialist if they need it. So we will first assess for things like any open wounds, signs of any sort of infection, including fungal infection. If there's anything questionable, then we don't do anything to that extremity. We would say maybe, for example, looks like you have some fungal infection on your feet. Let's look at your hands, and we'll do some hand hygiene care for that patient. We, in our scope of practice, are, have some guidelines in that way when we're out on our own. But some signs and symptoms you might see in a little visual for you. With athlete's foot, there's itching, cracking and peeling skin, and oftentimes that's between the toes, and some soreness of the feet there. So preventative care there, very important for feet to be cleaned daily with clean socks daily, and for people to keep them dry and dry between their toes after they wash them. We are able to give the hands and feet clinic patients a new pair of socks. We have enough to give everybody one pair. If we see that there's a low attendance, we probably have enough to give out a couple pair. And encourage them, if they're able to, change into clean socks every day. Wear shoes with ventilation holes and made out of natural materials. Air shoes out when you're not wearing them. And wear your shower flip-flops or something in a public shower. All right, we might also see ulcerations of the feet. Ulcerations are hard to look at, I know. So here's an example of a diabetic foot ulcer. I also have an example of some calluses. So for patients who are not diabetic, don't have any open wounds, no known history of peripheral vascular disease, we'll have for you guys at the foot clinic a foot file, and you can just straight back and forth after you soak the feet, try to file away some of that calloused skin. So there are some usual areas for calluses there. This is great before lunch, isn't it? You might also see a plantar wart. And you can buy over-the-counter things to treat those as well. There are little pads you can buy. There are some little containers of a liquid you can put on those, or you can do the cryogenic treatment where there's the freeze-dried stuff to get them off. We also have some visual here of nail fungus. So you'll see they're yellowed and brittle and broken. So we'll refer those for treatment as well if we see those. For diabetics, your treatment is really that they should do a good assessment of their feet, including between their toes every day. They need to look for wounds because those wounds will tend not to heal, so they need to be right on top of that, going to see their doctor if they see any wounds. So they also should wash their feet every day, be very careful to dry them between the toes. They should not soak hands or feet. Now, a lot of people will say they think this is because of their decreased sensitivity to heat, that they might burn themselves. But this is because they will tend to get little dry skin and little broken open places in their skin, and they'll tend to get infected. So they shouldn't sit and soak in the water, risking infection. They can apply lotion, but it shouldn't be between the toes because we don't want that moisture to stay there and risk growing infection between their toes. in our clinical organizations locally, as a rule, we do not trim nails, fingernails, or toenails for anybody. Particularly diabetic patients have a risk for infection, and we don't want to risk breaking open the skin. But our policy locally is not to trim nails, so we won't do that for hands or feet at our clinic. Your Perry and Potter book tells you about trimming fingernails and that you would cut them straight across and file them straight across. So we do have files. You can file nails. We even have some fingernail polish. If we have a lot of time and we're able to pamper people, we can even paint their fingernails or toenails as long as they don't have fungus. We don't want to paint over top of that and seal it in. But we'll just file straight across and then refer them if they need toenails cut. Important for our diabetic patients to wear well-fitted shoes, particularly that are not way too tight to squeeze their foot or too loose to rub blisters on their heels. And they need to be careful about heat and cold temperature extremes because sometimes there's a sensation issue there. Also about the hands and feet clinic, because this is so new, we are likely to go and have it be feast or famine, really. Maybe that there are a ton of people and maybe not. So we'll adjust, and if we have a couple of people, they get fingernails and toenails done. We can paint them and massage them and whatever. Take really good care of them. We'll adjust to that, and then if we have more participants show up, we'll have to choose hands or feet based on their condition and work on that. So all of our patients have an intake screening paper. If we're able to have some senior level nursing students come and help us, they will do an intake assessment, particularly to ask about wounds, diabetes, and known peripheral vascular disease. And then you guys will also look at that again, ask again, and look at doing some inspection and palpation before we try to do any sort of hand and foot care. And if there's anything you're concerned about, you'll tell your instructor, and we'll defer doing anything to that involved extremity and look for an alternative. Alright, so there is a document for you guys letting you know what to wear and where to go and what to do on Blackboard. And you will have a clinical instructor there with you. Myself and Mrs. Woody and some of your other leaders will be rounding at times to check on you. You'll have usually some senior level nursing students with you as well, so there's plenty of guidance for you. You're not on your own to say go out and do things, and good luck. We're there with you. But here's my reminder again about be careful what you wear. When you think about, you need to have on khakis and a navy polo shirt, but you are going to be sitting on a stool on the ground, so you want to wear a shirt long enough or tucked in or something to cover everything up. So that was my lovely illustration there. All right, so any questions about hands and feet clinic? There's a schedule for you on the sophomore bulletin board for that and for McKesson training, and that's also on Blackboard for you. All right, so you guys know oral assessment very well. You spent a lot of time on that last semester as far as what should things look like, with the mucosa being light pink and soft and moist and smooth, and you can describe the teeth and the tonsils and everything that's in there, right? You know what should be happening. You're aware of some things that go wrong as far as dry mouth, gingivitis, caries. Oral care is very, very important because we can not only get infection in the mouth, but actually lead to other infections based on oral care. There's even a link between cardiac health and gingivitis. So very important to consider oral care. So here's a picture here. We've definitely got some cheilitis going on with the dry lips and some erythema there of the lips and the tongue as far as your assessment. You also know a lot about hair assessment and some things we would ask about as far as chemical treatment, coloring, things that would impact hair such as nutritional status. And here's a good note about eyes and ears and nose. When you're helping a patient with hygiene, this is a good kind of intimate personal time where you're developing a rapport with them. So this is a great time to throw in some questions about whatever body part you're working on. So for example, when you're cleaning the eyes, the ears, the nose, the mouth. You ask about things like, how's your appetite? Do you have any trouble chewing or any mouth pain? Any changes in your ability to smell or hear? And sometimes you'll pick up on these things more. So this is a great time to do an in-depth skin assessment. And maybe you saw some patients last semester who were not particularly mobile a lot, and maybe it wasn't comfortable to them to be moved very frequently. So maybe you complete an initial assessment and prepare to give a bed bath, and then during that bed bath you're able to really look at the sacral area and all of those areas along the back to assess skin. So a good time for conversation and rapport and to ask about things. There's a note here about cleaning the patient's eyes and preventing getting soap in the eyes. A note about smell being important to appetite. And we've mentioned already you want to consider things like personal preferences and body image and what your patient's wants and needs are when you set them up for bathing. Do you feel like you have any trouble kind of controlling facial expressions when somebody shocks you or is very different from you? Do you struggle with that? Is it hard not to react to it? Yeah. And it's hard not to react to odors and things too. It's really different. I went to a really bad long-term care facility years ago when I was in my CNA training, and they didn't even have adequate supply of soap or anything. And so literally we would put like the Vicks, the vapor rub stuff you would put on your chest when you're sick that smelled really strong. We'd put that under our nose and around our nostrils every time before we went in there because it was so hard not to react to that. And I think usually your sympathy for the patient takes over and helps you get beyond that. But it's important to think about not expressing disapproval or reacting to things in a way that would be offensive just because somebody's different from you or there's something that's hard to see or smell or deal with. That's definitely something to think about. All right, what do you think about this? What's the best answer? Okay. So more about that later, but we'll have a variety of interpretive services available to us. Some that are really cool via web conference. They're available 24 hours a day. Within our local organizations, we will always have some interpreter services that are approved for medical interpretation, and that's always the preferred thing to do to communicate accurately with someone who doesn't communicate in the same language as you, that you're not able to speak to. But definitely we want to ask someone about their own preferences and involve them in their own decisions. So I've had these days myself when I felt like my own hygiene needed to be major when I left work. We stayed in a nice hotel when we left all the work we did in Rwanda, and they had hot water in the shower. And I took a shower, and I had an exfoliation thing done at a spa, and I took another shower, and then I got in the pool, and then I took a bath, and then I got up the next morning and I took another shower. And I'm not kidding. I was exfoliated and clean, but sometimes you have those days where you feel like you need to be clean. But imagine that your patient feels like that, laying in bed day after day. Do you know that you can lay in bed for days and still your fingernails and toenails will get dirty? People neglect those things, but to me it would be, I like to shower or bathe twice a day. It would be really hard to me to not be able to do that myself, and I know other people feel that way. All right, some more diagnoses we might think about with hygiene. We mentioned this before, but I'd say the mucous membrane problem would be most concerning to me. If there's an actual infection, that would be one of the most concerning to me. And then some outcomes we would want to list are things like skin clean, dry, and intact, patients well hydrated, free from areas of pressure. These are examples of things you would put as knocks on a care plan. All right, some key points about helping your patient with hygiene. If your patient has some areas that would be painful during movement, or this is going to involve any sort of wound care, you want to think about pre-medicating for pain in advance. So figure pills are going to take you 30 minutes-ish to start to work, and you can plan in advance. You want your patient to be independent as possible. It may be that you can bring in some supplies for them, set up a basin, or set up some of their washcloths, and just help them sit in a chair or at the side of the bed and do things themselves. It may be that they're able to ambulate to a shower. There are some really cool things in the hospital and sometimes in long-term care as far as nice showers and baths in patient rooms. I've seen some long-term care places with, you ever seen those replacement baths for older people on TV, and they actually walk in and close a little door and it's a whole bathtub that fills up that they can just step right into and not have to climb over into a tub. So some of our local long-term care facilities really have some things to let your patients bathe and be clean and independent as possible. All right, some different types of baths you might see. There are some different sort of hygiene that can be medicated or therapeutic. And one example is a sitz bath. You ever heard of that? If you know anybody who's had a baby, they might have used it. I don't think we have one available in here. It's probably in the OB lab. But basically, it looks like a big round basin. This is a bedpan that it'll do. It'll be a big round basin, and we'd actually fill up a bag like this with warm water. And it has a little place for the tubing to fit through. And you let go of the clamp and let the water run through while a lady who just had a baby sits on this. And the warm water circulates around their perineal area. And that's very cleansing and soothing, just to have the gentle flow of the warm water there. So that's something you are most likely to see in OB. After rectal surgery, some people I've seen use those. There may be different substances we would need to bathe with that are medicated. For example, before surgery, or sometimes on wound areas, there's a wash called chlorhexidine wash or Hibiclens, and those have substances that have a continual antibiotic action that works for a while. We may have patients who are limited to being in bed, and we bathe everything for them, or maybe we partially do this and let them be as independent as possible. We might also give back rubs with lotion, and we already talked about foot and nail care. All right, important things. Providing privacy, and I think it always helps to verbalize things, to let people know, okay, we're ready for your bath. I'm the only one in here. We will close the door and pull the curtain, and I'll stay here and help you. Or, you can do this part for your perineal care, and I'll step out for a minute and wait right outside the door, and you push the call bell, and I'll be ready to help you. Keeping your patient warm. Yes?
In this area, do they have the different types of lotions for different things? Like, one's just a regular lotion, one's for, like, feet and, like, places that there's heat pressure.
Through most of Centra, they use a product called Aloe Vesta, and they actually, I have a sample for you guys to show you. There's actually a whole chart of all their different products. So there are just some general, like plain unscented carry type lotions that are just kind of general use for the body, but then there's a whole line of different products to use if they're a reddened area, for example, or skin breakdown. So yeah, and that's different, and that will vary based on what hospital you're in. And skincare is something that changes a lot with research, with evidence-based, and what comes out as the best thing. So yeah, the current product line that I have information about is called Aloe Vesta. There were some really cool products I liked they had a while back. I don't know if it was an evidence-based issue or just the company they purchased from, but there was this foaming cleanser called Parafoam, and you could just spray it anywhere. And, sometimes patients come in and their feet smell so bad you can smell them outside their shoes. There are layers of skin there and layers of skin stuck in their hair and all these different things. And I just love that foam. It foams like shaving cream. And you just spray it all over and scrub it off, and works very well. But you'll see different products kind of rotate through. That's a good question. Let's see, what else do we need to cover? Let's do oral hygiene real quickly. So brushing teeth with toothpaste a couple of times a day is recommended, and that's best to help remove plaque and food. If your patient's able to do that on their own, you can set them up with a cup of water with a little basin to spit in if they're not able to get to the sink, and you can let them clean their own teeth. Sometimes you may have to brush their teeth for them. If they're alert and oriented and able to set up, you might just be able to help them. Maybe they have limited range of motion of their arms and aren't able to do that. But if they have speech, swallow, and gag and are able to speak to you and set up and spit on their own, you can still brush their teeth for them. You'll also see some items called a toothatte, and this will come in a package with a little cleaning solution too. And these can also sometimes come attached to a little suction device that would attach to a wall suction. So for patients who are unconscious, or maybe they're not supposed to have PO liquids or something and just have a really dry mouth and want to clean out their mouth, these can be used to clean out their mouth. For someone who is unconscious, they would need to be sidelined with their head elevated a bit, but sidelined so that they won't aspirate fluids. Like I said, there is a version of this that I've seen in ICUs that comes with suction attached so that you can get some cleaning with a minimal amount of water in there, but suck the unneeded fluid out so that they don't aspirate on fluid. Denture care. Did anybody notice some key points about denture care in your reading? You notice any key points yet? If you need to care for your patient's dentures, you can take them out and brush them just like real teeth, and they do need to be taken out and cleaned. But you see in the sink there, they have a washcloth there because dentures can break if you drop them, and they're very expensive and especially fitted to somebody's mouth, so you don't want to damage those. But put a washcloth underneath them and then use lukewarm kind of room temperature water to wash them with. If you put them in very, very cold water, they will tend to crack. If you put them in very, very hot water, they will tend to warp and become misshapen and not work. But you can brush them with a regular toothbrush. That's one of the things that grosses me out for some reason. I don't know. Some of the strange things, but I don't like teeth. Like, show me your intestines or your brain, I'm all good. Hand me your teeth, I'm a little bit freaked out. And then you can have a denture cup, and we actually have the little tablets that go in at the hospital to soak the dentures in water for them to be clean and fresh when your patient's ready to put them in. And label these and watch your patients because they will put them with their dinner trays or in their bed or wherever, and then they get lost and you're responsible for it. So remind patients about dentures and help keep up with those. All right, hair care I think is largely neglected because it's really hard to wash somebody's hair in a bed. If your patient's not able to get up into the shower, you'll oftentimes find nobody ever offers to help clean their hair. But there are a couple of different things you can do. Many places will have a tray that looks something like this to wash their hair in a bed, but also something really cool, and it works better than what you think. There's like a little shower cap thing that you can heat up in a microwave and put on their head and massage their scalp and then pull it off and dry and brush their hair. That actually works pretty well. And there are some no-rinse shampoos that you can comb through a patient's hair as well. Brushing their hair, and if you've never brushed long hair, this is a little bit challenging, but you can kind of hold some pressure in their hair if they have a lot of tangles and go from the roots to the end. But one thing that's really helpful, you have to ask for permission for this from your patient, but one thing that's really helpful in keeping tangles out of somebody's hair to do hair care is braiding their hair. So if you have hair that's any length at all and you've ever had to lie in bed for a long time and be a patient and there's all this matted, nasty hair everywhere and you can't wash it, you'd be really thankful to have somebody braid it. So that's actually in your textbook, but I think that's something cool because my mom's a retired nurse and that's something she always told me that she liked to do because people would neglect hair care, and she liked to wash and braid people's hair. And she worked in ICU, so you would have people who had brain surgery, head injury, all these things. She worked in neurological ICU. So to wash their hair and get all of that out and braid it is really cool. So, all right, this is really sad. I'm 36 years old. I took my daughters to my mom's house this morning to ask if she would braid my hair. So she braided my hair this morning. It's probably actually really sad, but it's just like a special thing. But true story. My mom braided my hair. But I can remember being in the hospital before I had my daughters. I had a too high level of mag sulfate, which makes you lose your deep tendon reflexes. I vomited all over myself. It was absolutely horrible. And it was just like, I want my mom. So my husband and my dad were there, and they're just not as helpful when you're really, really sick. So I love them to death. So my mom came and helped me take a shower and braided my hair, and I felt a lot better. So that's something you can remember to do for someone else. I had a student who I told this story to and had the opportunity to do that last semester. All those little things are a really personal time to bond with a patient and very cool. Shaving for a male patient, I mentioned, I think to you guys, I think is challenging for some reason for a woman. But some key points with that are to put a warm washcloth or something warm to soften up that hair first. We have nice new razors and shaving cream and things at the hospital, so we apply shaving cream and then have some traction to shave, but that's something for some reason I think is challenging. Maybe you have a husband or boyfriend who will let you practice. Or maybe we can ask all of our guys to let us practice in here. But there's something so different than shaving your legs or axillary area about shaving a man. I learned to do that in a nursing home, and everybody, it seemed like, had like rough skin and thick hair, so it was like, and you felt like you were really hurting somebody. But yes, we may have to shave people. Ask about their preferences, and I just felt like I would always say, like, which way do you go when you do this area right here, because it seems like there are so many different angles and things to work with. So, if they're able, you can say, oh, tell me what you do here, and get some help from them. But yeah, here's your picture of traction, and then shaving there with the hair, and it shows you're going down here against or with the grain of the hair.
I gotta mention something.
Yes.
When you shave this part right here under the maxilla, it's really hard. So what I do, I pull the skin and just do that.
Okay.
Like,
Can we do a sign-up list and you let people practice?
Sure.
So we need to do some sign-up list of guys will help you paint fingernails and put on Ted hose, and, and you can teach us how to shave a man's face. We'll take turns and use our colleagues to practice. But I don't know. Not shaving a man's not one of my favorite things. So yeah, this is what I just went on about, is braiding somebody's hair to reduce tangles is appropriate if it's okay with them. Alright, so you might have to do things like just basic, help somebody wash their eyes. You go inner to outer canthus with just plain water on a washcloth is good. Maybe clean their eyeglasses. Sometimes I kind of remind people to put their eyeglasses on because they're just literally sitting there in a dark room when you come in with no hearing aids in and no eyeglasses on. And it's like, okay, we need to get up. Can you see and hear me? Let's get glasses and teeth and hearing aids and all these things in. We may have to help we just clean the patient's ears with a washcloth and just get, kind of in the triangular fossa there, but don't go digging into anybody's ears with a sterile applicator, please. Just general cleaning of the nose and care of hearing aids. Generally, I will encourage people, if they're not wearing them, to keep in one of those little denture cups, and they can even label them left and right to keep up with them if they have both. This is something I've personally not ever had to do. You'll have patients sometimes with a glass eye, and actually by pulling up the lid and putting some pressure here is supposed to make it pop out, but I've not personally experienced that in my years of nursing. But they may need some help taking them in or out. Pictures of different types of hearing aids. And again, you can remind your patients to put these in to hear you and help them position maybe down in the canal. You can see there in the ear or behind the ear you might see. So a lot of things with these little devices is helping patients not lose them and remember to put them in or on when they're needed. Okay, so we mentioned keeping your patient warm, protecting privacy, your beds, and you guys probably should have already worked on occupied and unoccupied beds, correct? All right, and we spoke about raising your bed up to a waist height for you not to stoop and lean over. Same thing with bed bath. If you're doing that, you don't want to have to stoop, but you would want to have somebody with you on the other side of the bed, or put up the lower side rail to protect them if you're having to raise them up to your height. All right, safety and communication. Before you leave the room, you always lower the bed back down to the lowest position. Put your call light where the patient can reach it and see if they need anything else before you leave. Linen care, I told you to wear gloves, and always kind of put everything in the middle of the linens and turn it into itself so that you're having the part on the outside that was not touching the patient. There's a picture here of a surgical or recovery bed, and this is just meaning you're setting up the bed to allow for the fact that someone's transferring in from a stretcher. All right, let's see. We've spoken about privacy, communication, clean gloves. How do you test water temperature? Sorry? Right. With this is a good sensitive area here, the inside of your wrist, to assess water temperature. So never expose your patient to any water you've not tested for temperature yourself. So let's say you guys will go over a full bed bath on Monday, but let's say we run a full basin of water. We want to have a stack of washcloths for different parts of the body. And start with the eyes and all the features of the face. And then we move to arms and hands and axilla and so forth, uncovering each area as we go with a towel underneath it. But as we go along, we also continue to assess the temperature. And if at any point that water is cold, we're not wanting to decrease. We don't want to have them so cold that we're actually decreasing core body temperature, so we can go back, empty that, get more warm water, and come back to keep them comfortable and maintain their body temperature. All right, we discussed this a little bit with foot care, but I have some special read this reminders for diabetic oral care and foot care. So that's remember to review that as you go back through to read. All right, so I was trying to move along so we could get through this PowerPoint. You will have some demonstration of all of your oral care, bath, perineal care before you do any checkoffs on Monday. But any questions about what to do, when things are due, these PowerPoints, any questions? Yes?
Where is the McKesson stuff at? Like, where do we go with that?
It's on the sophomore bulletin board up here. There's an address.
Where is it?
That's out there too. So there's a schedule for it, and there's the physical address of where it's at. Yeah.
Oh, I know what mine is.
Yeah, you do wash your hands. I think I do too. It's nice and really fun. Trying to get it all clean. Is there anything yeah. I think I have a sanitizer. You have to get I think so. Either that or the opposite of that. Yeah. Hand hygiene before you put it on. I like doing hand hygiene as I walk before you can sanitize Yeah, me too. I was doing it too, The Activos training, you don't have to sign up for it. It's just here whenever you have time. They have a video for you to work through, and then there's nothing about it. So you can ask whether they're all here. And so Acudose happens in here, and then the schedule for McKesson and Foot Clinic are on the bulletin board out here. If anybody was impacted by things being canceled yesterday, I have to wait for Mrs. Schmidt to give me an updated schedule for This is in here for you. As long as you put it over there.
Okay, is there a sauce?
Yeah, but then she texted me and said, yeah, the last one might be. Yeah.
Okay.
Originally there wasn't, but I think they have it.
Okay.
I know, but then she texted me later that night.
Oh, I'm just coming right here. Here you go.
I like it a lot. Thanks. I have to go finish something.
Yeah, I didn't even know you read that until like I read the thing for the black one. I was gonna go over. This book. What if I can go that is cost $100?
I've been trying to get me to join the military.
Oh my goodness, so
That's
Yeah.
Sorry, I wasn't trying to be rude when I was texting and talking at the same time.
I see.
She missed the class.
Thank you so much, Ms.
And she asked, like, emailed her professor and asked permission to miss the class, and she was like, yeah, that's fine. And now she has to write like an essay about something for missing the class. I was like, I've never heard that before. Like in elementary school.
So my husband was right outside and I was like making squeeze shampoo and yeah. And he's like, what else do you need? When I broke my arm, it was my first shower after surgery. I was all casted. My husband was right outside the shower. You know, whatever I needed, he was there to help. And he said, okay, anything else? I said, yeah. I said, okay. And I pulled the shower curtain back and I handed him my razor. And he looked at me and I went like this. Yeah. And he was like, really? I said, I can't hold the razor. Why do you want me to shave? I couldn't get a shave it.
Oh, that's like the
I could do the one, but this was casted and I was all...
Yeah, I feel like my husband's great and he'll try, but he's not the best at stuff like that. So I've had situations where I have my mom help me.
We were in Pennsylvania staying at my in-laws, and so I was not comfortable with my mother-in-law
Oh
helping.
no, I wouldn't be either. My mother-in-law
That
totally
would be
would
so
and not be
awkward.
embarrassed at all, but it would bother me.
Yeah. I don't know which one.
Alright.
Have a good week.
Oh, we do?
You guys have a good week too. My mother-in-law's the type who'd be like, here, tell me what this rash is. And I'm like, no,
Yeah,
my eyes.
Mine went to an online, like before there were computers, just mail order. And so she has a bachelor's in holistic nutrition.
Oh.
So she will, she told us we were putting Lexi into liver failure because I gave her Tylenol one day.
Oh wow.
So
Your mom?
my mother-in-law.
Oh.
We don't talk much about medical.
No, I wouldn't.